Okay, it's talking about gynecological and pregnancy terms. Dysmenorrhea, this is pain during menstruation. Headache, faintness, dizziness, nausea, diarrhea, backache, leg pain caused by muscular contraction of the myometrium. Infection, inflammation, presence of the endometrial device, IUD. Middle skirmers, I don't even know. Pain may occur as the result of follicular rupture and bleeding from the ovary during the menstrual cycle. Pain in the right or lower abdominal quadrant during normal mid-cycle of menstrual period. Differentiate the pain from appendicitis or other surgical emergencies. So if it was appendicitis, we would locate the iliac crest and about 2 inches towards the umbilicus, the belly button. We're going to palpate, press in, no pain. We remove it, then we're going to feel pain. That's how we know it would be a bursting appendix. Gravida, this is the number of times that children have been attempted at pregnancy. Para is the number of babies that have actually been alive and come out. Yep, number of times that a baby's been pregnant. Para, yes, number of infants born. Antepartum, this is the maternal period before delivery. Intrapartum, intrapartum, the maternal period during delivery. Postpartum, this is after delivery. Term in pregnancy that has been reached, 40 weeks gestation. First stages of labor, this is going to begin with contractions and end when the cervix is fully dilated, 10 centimeters, thought it was 8 to 10. Second stages of labor. This is measured from a full dilation to delivery of the newborn. The third stage of labor begins with delivery of the baby and ends with the placental delivery. These all matter. Precipitous births on onset labor to birth is less than 3 hours. Just to reiterate this again, so beginning to contractions and end, fully dilated, that's first stage. Second stage is measured from full dilation to delivery of the newborn. Third, last stage, is whenever the placenta is born. Gynecological and pregnancy emergencies. So you could have an ovarian cyst. This is the thin-walled fluid sac on the surface of the ovary. Could result in significant hemorrhage. Abdominal pain is caused by rapid expansion, torsion of acute rupture. Vaginal bleeding or late missed periods at the time of the rupture is also going to be localized pain, one-sided lower abdominal pain. So we're going to manage that by giving IV fluids to prevent hypovolemic shock. We also want to make sure we manage the pain, so we're going to give analgesics. Could be an ectopic pregnancy, so this is very dangerous and could put the woman at risk. Ectopic, meaning it is away from the place that it's supposed to be at. So that could be in the fallopian tube. The third leading cause of maternal death. Typically found at 8 to 12 weeks gestation, vaginal bleeding. So this is crampy abdominal pain or spotting. It's going to be rigid or stiff board-like abdomen. After the rupture, the severe abdominal pain and vaginal spotting in the internal hemorrhage. There could be sepsis, could also be shocks. We're going to manage that by giving IV and fluids as well, pain management and rapid transport. Time is at the essence here, just like with a cardiac myocardial infarction, also with a stroke. Placenta previa, and then there's abrupto placenta. Which one sounds more violent? Abrupto placenta, because it is. Placenta previa. Previa meaning before. Placental implantation in the lower uterine segment, partially or completely covering the cervical opening. This occurs in about 5 to 1,000 pregnancies. Our signs and symptoms, it's going to be third trimester pain or aching, but the placenta previa itself will be painless. There'll be bright red bleeding, strongly associated with the number of previous C-sections and deliveries. The most common cause of preterm bleeding, pre-placenta previa. Abrupto placenta, so partial or full detachment of a normally implanted placenta at more than 20 weeks gestation. Occurs in about 1% of all pregnancies, results in fetal deaths in about 15% of cases. So signs and symptoms of this, third trimester pain, stabbing, painful, dark red bleeding, and localized uterine tenderness. So this is like, imagine a scab if you scrape your elbow from a skateboard. And then you peel that scab off. That's what's happening with the placenta abrupto. Hurts. No. Preeclampsia and eclampsia. The difference between this is, I should know this, gestational hypertension after 20 weeks, after 20 weeks, and at least one of the following: proteinuria, protein in blood and urine, low platelet count, impaired liver function, renal insufficiency, pulmonary edema. So renal insufficiency, you're not going to have efficient kidneys and filtering of the blood. Pulmonary edema, it's going to be swelling because of the heart, and visual cerebral disturbances, things affecting the central nervous system. Severe HTN characterized by systolic 160 and diastolic 110. So if you have 160, what is it saying? Characterized by systolic above 110 and diastolic less than 110. So you're going to have a wide BP. IV and oxygen, PRN, calm transport is what we want to give. Oxygen, IV, and transport. Okay, so this one is preeclampsia plus a seizure. So the difference is the seizure. So how are we going to remember that? Eclampsia, preeclampsia. Just think of, I really don't have anything. So eclampsia, this is what it is, and then leading up to it is preeclampsia. This is the crescendo, which has more results from it. That more results is the seizure. You're going to have tonic-clonic activity, grand mal seizure. The body, all of it, will be full seizing, not just part of the body. Labor can begin suddenly, progress rapidly. Left lateral recumbent positioning, just like with any abdominal hemorrhaging, or diving, if we have diving injuries and other injuries. So always lay them on the left side. Magnesium sulfates. This is one of the instances that we would give magnesium sulfate other than asthma. So we're going to give 4 grams over 10 to 20 minutes. Before that, though, oxygen and IV access to give the mag sulfate. Can consider benzodiazepines. Each seizure increases fetal mortality by 10%. Can occur up to 4 weeks postpartum. However, that is rare, but at least it's not affecting the baby. Benzodiazepines, we don't want to get the baby addicted to Versed or midazolam. Gynecological pregnancy emergencies. So postpartum hemorrhage, 500 milliliters of blood typically lost after delivery. This occurs within the first 24 hours. It accounts for 25% of obstetric deaths. Management, fundal massage. This is going to release oxytocin. So you are going to, I don't think it tells you how. So fundus massage, typically it's going to be higher than you think it is. It's not down here. It's going to be like almost not where the xiphoid process is, but close to it. And you're like kneading dough. You're pressing into it. This is not a light massage. Think deep tissue massage. You're trying to push that, and it's going to stop the bleeding. If that doesn't happen, we're going to do breastfeeding, because breastfeeding helps. Oh, that helps with uterine contraction, and then breastfeeding administers oxytocin naturally through the body, which is going to also stop the bleeding. 10 units per liter infused at 20 to 30 drops per minute. So that's what breastfeeding does naturally. And then we're also, if we have it on board, we'll give oxytocin ourselves. Amniotic fluid embolism. Amniotic fluid enters the maternal circulation during labor or delivery, or immediately after through lacerations of the endocervical veins. Endo meaning inside, cervical, cervix. Veins, lower uterine segment, or uterine veins. This occurs in 6 to 15 or per 100,000 deliveries. Maternal mortality rate is high. Signs and symptoms mimic that of pulmonary embolism. So as if there was a embolus in the lungs or somewhere through the pulmonary vein. Chapter 3, respiratory and airway. No, can't believe I did that. Come back. Where we at? Where we at? Trauma during pregnancy. ABC is first, so BLS before ALS. Aggressive resuscitation. After the first trimester, never transport the pregnant patient flat on the back. This is going to lead to supine hypotensive syndrome. So basically, you have the weight of the baby is now pressing on, one, the vagus nerve, and two, the inferior vena cava, the largest vein in the human body. This is the vein that leads away from, leads away from the heart. Arteries go out, so the aorta vein. So this is the blood that is coming back from the body in through the lower portion of the heart, the superior vena cava. Well, I'm done.